Hey guys, Jenna, Barrett, and myself were asked to do a presentation on professional boundaries in nursing. So I've made a poster board. First of all, professional boundaries in nursing are defined as the limits which protect the space between the professional's power and the client's vulnerability. That is, there are borders that mark the edges between a professional therapeutic relationship and a non-professional personal relationship. So here I've just put just a little picture, your space, their space. Jenna did point out a very important fact that there are boundary crossings and boundary violations. A crossing is just a deviation from the classical therapeutic activity that is harmless, non-exploitive, and possibly supportive of the therapy itself. But in contrast, a boundary violation is a harmful or potentially harmful to the patient in therapy. It constitutes exploitation of the patient, so it does harm. We do have a code of ethics that we go by. The nurse is supposed to strive to maintain appropriate professional boundaries at all times and to avoid compromise of the therapeutic relationship. A nurse-patient relationship and a nurse-colleague relationship differs from personal relationships. But the Code of Ethics does state that when the nurse finds that the professional boundaries are becoming endangered, they should seek assistance professionally to remove themselves from the situation. You do need to know your state Nurse Practice Act. It's different depending on which state you're in, so that's your responsibility to know as a nurse. Another thing that needs to be looked at is social media bandwagon. Facebook, Twitter, Instagram would have it, whatever you have. You have to be careful about being friends with patients on there. It seems harmless at first, but you have to consider if you just post that you're having a bad day, or I can't believe I have to go back to work today, and then you see that patient that day, they're going to know that something's wrong, and they may not feel confident in the care that you're able to give them. Jenna did point that out. So that's a very thing. So this is that's our presentation for discussion number 14. Thanks, guys.